Good morning, everyone. First of all, I want to thank Dr. Kanchi for giving me this opportunity to participate in this very important meeting. I'm going to talk about role of artificial intelligence in echocardiography. Artificial intelligence, as we know, is there everywhere, all around us. We don't experience it, but we are using it. Even a plain, simple Google search is AI driven that we don't realize. Now, medicine is a field which can be greatly benefited from artificial intelligence because medicine by nature is an intuitive science which has a lot of subjectivity and variability. And because of this, it is very difficult to master medical science. The solutions that we have today, they rely on various algorithms, diagnostic criteria, and cutoff values, which although make our tasks simpler, they have lots of limitations. And the biggest problem with these algorithms is that they do not allow any flexibility. They use fixed cutoff values, and they, according to these algorithms, the interrelationships between various parameters is fixed. But this is not how medicine is. Things change from person to person, from patient to patient. So unlike this, how a trained clinician works. So whenever a trained clinician encounters any clinical scenario, his brain immediately looks for important relevant points and then tries to connect them to reach a diagnostic interpretation. So this is how human brain works, and this is how a clinician works. Now, today the computer power has increased so much that we can make computers behave exactly like this, and that is what is known as artificial intelligence. So in simple term, artificial intelligence means any computer program that mimics human logic and intelligence. Machine learning is a part of artificial intelligence, which is a process by which we train computer algorithms to learn various patterns and to make diagnostic predictions using a large amount of data which we already have. Deep learning is further subtype of machine learning. It is a very complicated science. In this, the information that we have is processed through a network of multiple layers which are interconnected, just like we have neurons in our brains. And these layers then analyze different attributes of that information to reach diagnostic predictions. So this is also known as deep neural network or convoluted neural network because of its similarity to our neuronal system. So this kind of model is particularly good if we have to analyze very complex data, and it is also very good for analyzing images. Now, a basic prerequisite for developing a good AI model is to have a large amount of training data. Now, fortunately, echocardiography generates a lot of data. Every echo study that we do, we make so many measurements, many of which we do not use, but they are available. And at the same time, we are doing hundreds of thousands of echocardiogram every day all over the world. So a lot of echo data is being generated. And then we have information coming from other sources as well. Like we have to look at clinical features, there are various laboratory investigations, and there are other imaging modalities. So there is a lot of information that needs to be integrated. Now, this is something which is beyond human capability, but this provides an ideal platform for developing an AI model, because for AI model, we need a lot of good quality data. When we train any AI model, what AI does is that it analyzes all the data, integrates it, finds patterns, and then associates with various disease patterns or phenotypes to reach diagnostic predictions. Now, all this training can happen in two broad ways. One is supervised machine learning, and second is unsupervised machine learning. In supervised machine learning, we use data which is already labeled. What it means is that we already know the diagnosis, we give that data to the machine, and then the task of the machine is to find various attributes that predict those diagnoses. In unsupervised machine learning, which is actually the bigger part of machine learning because most of the echo data is not labeled. So here we give unlabeled data to a computer algorithm, and then computer algorithm on its own tries to find clusters or patterns and comes up with various phenotypes that we try to correlate with outcomes. So that is how machine learning happens. So what are the common applications of artificial intelligence in echo? Now, in my opinion, the most important role that AI can play is in interpretation of images or information, making diagnosis, and making predictions about prognosis. This is an area in which we humans do not do very well, and this is an area where AI can create immediate impact and can immediately influence patient management and outcomes. And I'll show you some examples. So this is one paper published 6 years back by Dr. Partho Sen Gupta from US. He is one of the leaders in this field, and I was happy to be associated with him in this project. So here we used a machine learning algorithm to distinguish constrictive pericarditis from RCMP, which is, uh, as we know, a very complex diagnostic conundrum in echo. So now, if you look at the findings here, the machine learning algorithm achieved 96% accuracy in making this distinction using 4 echo variables and 15 variables derived from speckle tracking. These 15 variables were automatically identified by algorithm without any human intervention. So this kind of accuracy is mind-boggling. Over last 6-7 years, machine learning field has exploded with technology. A lot of advances have happened, and a lot of very exciting work is now happening. So this is one very recent paper uh, published again by Dr. Sen Gupta's group looking at diastolic dysfunction. So what they did here was they looked at more than 1200 echo. They used it for creating a deep learning model which categorized this data into a high risk phenotype versus low risk phenotype. And when they correlated it with various endpoints, they found that this algorithm worked much better with as compared to the 2016 ASC diagnostic 2016 ASC diastolic dysfunction guideline algorithm. So it had better correlation with hemodynamics, better correlation with cardiac biomarkers, exercise capacity, and most importantly, what they did was they applied this algorithm to TopCat data. So TopCat is a study which was conducted to evaluate therapeutic utility of spironolactone in treatment of patients with heart failure with preserved ejection fraction. So spironolactone was not found to be useful in this overall cohort that was included in TopCat, but this algorithm could identify patients who had much worse spironolactone. So this again is quite remarkable, and this has potential to change how we manage patients with heart failure with preserved ejection fraction. Another example, again from Dr. Sen Gupta's lab, looking at aortic stenosis, which is again a complicated uh, entity, which we are now understanding. We know that in more than 1/3 of the patients, valve gradients do not match with aortic valve area, which creates a lot of confusion. So here they developed a deep learning model and again identified high risk phenotypes versus low risk phenotypes, and they found that the patients who were found to be at high risk by this machine learning algorithm, they had higher risk of AVR, higher mortality, greater prevalence of fibrosis on CMR, worse clinical outcome, and higher prevalence of calcium in the aortic valve. So in short, this algorithm could classify severe versus non-severe AS much more accurately than the echo parameters that we are using currently. Now, another study from a different group, here the investigators collected data on more than 170,000 patients. This data was already there in their EMRs. The patients had undergone echocardiograms multiple times, so more than 30,000 echoes were available. From all this, 100 clinical variables and more than 500 echo variables were extracted, integrated, analyzed by a deep learning model to predict 5-year survival. Now look at this. Here, these dots represent 5-year survival predicted by Framingham risk score, accuracy of Framingham score for predicting 5-year survival. And here is the accuracy of machine learning model. Remarkable difference. So again, shows the potential of machine learning model for making predictions. And this is sure going to change how we are going to manage patients in future. The other area where AI can help is in improving day-to-day working in the echo lab by automated analysis, automated measurements, automated interpretation of the images. And many of these tools are already available in the current generation echo machines. We have tools which allow us to do all the measurements of the velocities, gradients by just one single click. We can do volume quantifications, we can measure strain, we can do all sorts of EF and other calculation without much manual intervention. We have to just make some clicks and the system does it automatically. We also have tools that can very comprehensively analyze valves. That information is very helpful in planning valve interventions. So one example is here, the patient has to undergo TAVI, 3D TE is done. Once these images are acquired, the system automatically creates this model, and from this model, it generates all these measurements, which are quite valuable. This is the information that we usually derive from CT, but echo, 3D TE, and artificial intelligence-driven echo modeling can provide all this data in a very short period of time with minimal manual intervention. Now, all this is already available in the machines, but there is a lot of more exciting work happening, and this is something which is, I feel, totally outrageous. Here, investigators looked at more than 14,000 echocardiograms, and they used a deep learning model, trained it to identify the views on its own. So now we don't have to tell the machine which view it is. It automatically identifies that this is 2-chamber, long axis view, 4-chamber, short axis, and flex. Once it identifies views, then it does all the measurements like LV end diastolic volume, LA volume, ejection fraction, and global longitudinal strain. Everything done automatically. And then the algorithm could also make some very important diagnosis like hypertrophic cardiomyopathy, PAH, or amyloidosis. So all this totally automatic, no manual intervention, and this pipeline is already available. We have to just upload our images on the system, and the machine will do everything. It will do segmentation, identify views, do measurements, make diagnosis, and generate a report. Now, the third thing where AI can play an important role is education and training. So whatever we have discussed so far was about automated analysis and interpretation of images. Now, for that to happen, we need images. And for images, we need trained sonographers. So that again is a challenge to have trained sonographers available everywhere. Here again, AI can play a big role. And this recent COVID pandemic has created a wonderful opportunity to develop such tools and test them. So these are some of the papers related to this area. They talk about this software, which can be used for giving real-time guidance to sonographer in acquiring good quality images. So even a novice sonographer can use this tool, and this tool will then guide that, okay, you want to acquire plaques. So you put your transducer here, rotate it like this, tilt it like this. And once this system finds that the image which is coming on the monitor is good one, it tells you to record it and then move on to the next image. So even a novice sonographer becomes enabled to acquire good quality images with the help of this tool. So this again is quite remarkable. So you have tools for training the sonographers to get good quality images. And then once you get good quality images, then we have got all the different machine learning models to analyze those images and provide data. So I will end my presentation with this editorial, again by Dr. Parthu Sen Gupta. Whatever I showed you about artificial intelligence, that is something which is already happening at a very fast pace. So many tools have already been incorporated in echo machines, and many more are going to come. And therefore, one starts wondering whether artificial intelligence will replace the human echocardiographer. So the answer to this question is no, definitely no, because human intelligence cannot be substituted. There's nothing like human intelligence. But what is going to happen is that people who do not use artificial intelligence in future will get replaced by people who use artificial intelligence in their daily work, because artificial intelligence empowers us to do our work in a better manner, more efficiently, more accurately, and more intelligently. So this technology is already there, going to enter into our echo labs very soon. We need to remain vigilant, and as soon as and when it becomes available, we need to embrace it. Thank you.